Okay, it's recorded.
Okay. My case study, let me start it like this. A 43-year-old Magdalena was taken to a specialist clinic without having an appointment with a doctor. Someone, Jennifer, who saw what happened to her, took her to that specialist clinic and called to inform the family that Magdalena was driving on a road she cleared and started shouting that her vision was gradually disappearing, and she was rushed to the hospital where the doctor observing the sign of Magdalena that she's suffering from a mild to a severe visual loss detention and gradual loss of her central vision and loss of shape vision. She was feeling pain that rolled down her two eyes within an hour, and the doctor discovered that Magdalena was suffering from a certain disease. So I don't know if someone here, if any of you have the idea of the kind of disease that Magdalena was suffering. Any idea?
Oh, wow. Can you repeat the signs and symptoms, please? Just that.
Let me repeat the question again. A 43 years old Magdalena was taken to a specialist without having an appointment with a doctor. Someone who saw what happened to her while she was driving called to inform the family that when she parked her car on the road and started shouting that she has lost her vision gradually and was rushed to a hospital where the doctor observed a certain sign of severe visual loss, detention, and gradual loss of her central vision and loss of sharp vision. She was feeling pain that rolled down her two eyes within an hour, and the doctor discovered that Magdalena was suffering from a certain disease. I don't know if any of you have any idea of the kind of disease that Magdalena was suffering.
It's a refraction error.
No?
Glaucoma, how is name?
No? Let me do so that I save time. It's macular degeneration. Macular degeneration, a disease of the eye.
Okay.
And the
And Kosi, you have it.
macular
Yeah.
degeneration.
Let me check.
Hello?
I'm talking with Kosi. Check.
Macular degeneration. The diagnosis is routine eye examination and green to detect small change in vision. That is, it makes someone not to see clearly. Hello?
Yeah, we are
The,
thinking.
the diagnosis, is a routine eye examination and grade to detect small change in vision. That is, in a layman understanding, is that when someone have when a normal eye is functioning and someone start experiencing a gradual vision, start observing things gradually, not seeing things the way he's supposed to see, and what he's seeing start disappearing, it's called small change in vision. It's under macular degeneration. And
Yeah.
the treatment, it's pharmacological treatment and laser therapy. It may delay the onset of blindness, while the prevention is adequate intake in zinc and vitamin A, C, and E.
Okay. And
This is that. Sister Ngozi, did you see it like that?
what?
What?
Did you see it like that? Macular degeneration,
This is a
disease of the eye.
the name of the disease. Macular degeneration. No, this is a
Macula, yeah.
typical sign.
Macular. Is it?
It's a macular degeneration.
Macular degeneration, yeah.
It's the name of a disease, or it's a typical sign.
It's an
or
eye
it-
disease. It's an
Yeah.
eye infection that makes someone not to see clearly. For example, someone was seeing clearly and he start always seeing something faintly. That is, things going small and disappearing.
Okay.
Mm.
And the prevention is the intake of zinc and vitamin A, B, and E.
Oh, yeah. Okay.
Okay.
Oh, okay. So, okay. Okay, now choose who will be the next to explain his case.
Sister Linda, you might be the next, or Sister Nkosi, any of the two.
Okay, okay. I will be the next, okay?
Okay.
I only have one case. Okay. It's easy. I suppose they do have everyone in your life. I don't know, but in my case, I have 3 times. Okay. The case is a 17 years old female patient came to the ophthalmology clinic 10 days ago with pain in the lower eyelid. 5 days ago, the patient presented a mass in the lower eyelid accompanied by pain of 7/10 in EVA. Eyelid edema and tearing. No significant personal or family history. Okay, what do you think is the diagnosis for this?
Sorry, Stalin, can you repeat again?
Okay. A ver. I will read the
Yeah,
sign.
is it glaucoma? Glaucoma.
No. Okay. The patient has pain in the lower eyelid. Here. Okay.
Can I mention it? Can I
5
say
days
it?
ago, the patient.
I don't know. Yeah, stay.
Wait. Listen to me. 5 days ago, the patient presented a mass in the lower eyelid, accompanied by pain. Okay, it's an edema. What is the name, or what do you think is the name?
Wait.
It's something similar like acne, but in the eyelid, it has another name.
Stay.
Yeah, stay. Or deolum or stay. Yeah, guys. This is the diagnosis.
Can you check the message and see if it's correct?
Yeah. I saw your message.
Oh,
it's
okay.
the same. Okay.
That was
well. The treatment for this condition is disappear on their own in 5 to 7 days. But in my experience, no disappear in 7 days. It disappear, I don't know, 1 month.
Okay.
Yeah.
I thought it was
And then put warm compresses applied to the eyes for up to 10 minutes. Yeah, it worked. And then, but sometimes depend on the patient, it can removal of an eyelid maybe followed by post drain, and the patient can do a surgery to put out the stay. And that's all. That's my case.
Sister Linda, sorry.
Mhm.
Sorry.
Okay.
Yeah. On that treatment, because there was something I did not really understand on that treatment of stay. When I saw antibiotic eye drop, because I've come to realize, because I made a doctor friend and he told me that it depends on the individual.
Yeah,
That
it
before an
depends.
individual
Uh-huh.
that before an individual is prescribed on
Yeah.
a certain vaccine or medication, that he has to undergo a diagnosis, a certain tests. So I
Yeah.
was asking, is it that you cannot just buy any eye drop and put? He said no, that the patient has to undergo a certain test to
Yeah.
confirm.
Yeah. Yeah. All the treatment will depend about the level of the stay and the kind of patient. Yeah, that's true.
Okay.
Okay. Now,
Okay.
Koki, it's your time.
Thank you. Mine says a 47-year-old male was involved in a car accident
Yeah.
that led to a chronic inner ear syndrome. He would have isolated attack every once in a while. What could be the problem, or a disease or disorder for this case? He is 47. He is involved in a car accident
Yeah.
that led him to have a chronic inner ear syndrome. Sometimes he would experience isolated attack every once in a while.
Wow. Oh, let me check. Okay.
Sister Nkosi, please don't be angry. Repeat that your question, your case study.
47-year-old male was involved in a car accident that led him to chronic inner ear syndrome. Sometimes he would have isolated attack every once in a while. What could be the problem? Or what disease or disorder the situation of him?
It can be corneal abrasion.
No.
Okay.
I think it's otitis
Hmm?
Um,
What?
media. Is it otitis media? It's a disease of the ear, right?
Yeah.
yeah.
Is it otitis media?
A disease of ear.
Yeah.
Then what are you saying? Hello?
Brother Annabelle.
Is it a disease of the ear or
My network
the
is
eye?
very bad.
Because I
Ear.
heard
A disease of ear.
Yeah, I overheard you. Hello?
Yeah,
Yeah,
we're hearing.
is it, that is what I'm asking. Is it otitis media has to do with a Down
I
syndrome?
can't.
Let me write it.
The signs of it, it's vertigo.
Is it this one? Otitis media.
No,
No.
the signs and symptoms is vertigo. I don't know if I'm pronouncing it right. And tinnitus and hearing loss.
Oh yeah. Yeah. Okay. I heard about the disease. Here is
Okay.
tinnitus. Tinnitus hearing in Spanish.
Okay.
Yeah.
What is it?
The treatment? Where is the treatment? The treatment for this week it is the patient need take I cómo se dice this anti-inflammatories, right?
Anti-inflammatories. No.
No.
From
Is it
no,
i-
no,
is
from the
it
ones
is it
that I have here, the treatment wise, I don't have the inflammatories, and unless it's in the textbook.
is it finally is it motion sickness? Mr.
What?
Kosi, is it
Hello.
motion sickness?
What's that?
Wait.
Treatment is salt-free diet.
Yeah.
One of the treatments. They also say that certain intervention may be necessary to remove the inner ear sense organ because that's what he had after the car accident.
Okay. Okay. I think that I think that's all right. Or you have another case.
Should I write it, the diagnosis? Yeah, that's correct. Yeah,
Yeah.
it is
Meniere's
correct.
disease. Oh. Okay.
Yeah, that's
Is
correct.
that the disease?
Yeah, that's correct.
Is that the disease?
Yeah.
Yeah,
Yeah. Today he has the points.
okay. I think that's it.
But sorry, let me ask a question.
Okay.
Mr. Kosi,
Hello.
yeah. But what this disease, according to you, you said the prevention has to do with a salt-free diet and some other snacks, right? But is
What?
it possible that we can? Is it possible that we can eat a food or a junk food that is not salty?
Eat food that is not salty.
Yeah, because most of the food we buy it in Italy, and it's how will we know?
How will you know if it has salt or not? Is that what you're asking? Hello?
Sorry, I don't get it. Okay. Brother, do you have another question? Brother Annabelle?
I think he's struggling with network because I can't hear him as well.
Oh my gosh, again it's gone. So I think we're gonna finish our meeting.
I think we should.
Yeah.
I think
Okay.
we should.
So this is our final meeting. Okay.
Yeah.
Thank
So
you.
you're
Thank
gonna
you,
stop the
Nakosi.
record.
Thank you, Nakosi, for the meeting and for all the last meeting.
Thanks to you, hey, you made it possible for us to continue with it as I was struggling to find a
Yeah.
group to join. But
Yeah.
you were available. We did it after week 13.
Yeah. Only we have two quizzes more, and then that's all. Oh my gosh. I need to study.
It is. I think we should stop recording now so that it won't be long or
I will stop the
something.
record, okay?